Welcome to Damal Consult Career Academy. In today's video, we'll be diving into 50 essential healthcare terminologies that every healthcare professional should know. Whether you're a student, a new graduate, or a seasoned professional, understanding these key terms is crucial for effective communication and providing top-notch patient care. Stay tuned as we break down each term to help you expand your medical vocabulary and enhance your career in healthcare. Here's a list of 50 common healthcare terms. 1. Acute, a condition with a rapid onset and/or a short course. 2. Anemia, a condition in which the blood doesn't have enough healthy red blood cells. 3. Antibiotic, a drug used to treat bacterial infections. 4. Asepsis, the absence of bacteria, viruses, and other microorganisms. 5. Biopsy, the removal and examination of tissue from a living body for diagnostic purposes. 6. Cardiology, the branch of medicine that deals with diseases and abnormalities of the heart. 7. Chronic, a condition that lasts for a long time or recurs frequently. 8. Diagnosis, the identification of the nature of an illness or other problem by examination of the symptoms. 9. Diabetes, a metabolic disease that causes high blood sugar. 10. Dialysis, a procedure to remove waste products and excess fluid from the blood when the kidneys stop working properly. 11. Electrocardiogram, ECG, a test that measures the electrical activity of the heart. 12. Endoscopy, a procedure where organs inside the body are looked at using an instrument called an endoscope. 13. Epidemiology, the study of how diseases spread and can be controlled. 14. Hypertension, high blood pressure. 15. Immunization, the process by which an individual's immune system becomes fortified against an agent. 16. Inflammation, a localized physical condition in which part of the body becomes reddened, swollen, hot, and often painful. 17. Intravenous, IV, administered into a vein. 18. Laparoscopy, a surgical diagnostic procedure used to examine the organs inside the abdomen. 19. Leukemia, a type of cancer that affects blood and bone marrow. 20. Malignant refers to cancer cells that can invade and destroy nearby tissue and spread to other parts of the body. 21. Metastasis, the spread of cancer cells to new areas of the body. 22. Neurology, the branch of medicine dealing with disorders of the nervous system. 23. Oncology, the branch of medicine that specializes in the diagnosis and treatment of cancer. 24. Orthopedics, the branch of medicine dealing with the correction of deformities of bones or muscles. 25. Palliative care, specialized medical care for people with serious illnesses, focused on providing relief from symptoms and stress. 26. Pathology, the study of the causes and effects of diseases. 27. Pediatrics, the branch of medicine dealing with children and their diseases. 28. Pharmacology, the branch of medicine concerned with the uses, effects, and modes of action of drugs. 29. Physiology, the branch of biology that deals with the normal functions of living organisms and their parts. 30. Prognosis, the likely course of a disease or ailment. 31. Psychiatry, the study and treatment of mental illness, emotional disturbance, and abnormal behavior. 32. Radiology, the science dealing with X-rays and other high-energy radiation for diagnosis and treatment. 33. Rehabilitation therapy, aimed at enabling patients to recover skills or functions that have been lost or impaired. 34. Sepsis, a potentially life-threatening condition caused by the body's response to an infection. 35. Sutures, stitches used to hold tissue together after surgery or injury. 36. Therapeutic, relating to the healing of disease. 37. Thrombosis, the formation of a blood clot inside a blood vessel. 38. Transplant, the transfer of cells, tissues, or organs from one site to another. 39. Trauma, a physical injury or wound caused by external force or violence. 40. Ultrasound, imaging technique that uses high-frequency sound waves to produce images of structures within the body. 41. Urology, the branch of medicine dealing with the urinary tract and male reproductive organs. 42. Vaccine, a biological preparation that provides active acquired immunity to a particular disease. 43. Vital signs, clinical measurements that indicate the state of a patient's essential body functions. 44. X-ray, a form of electromagnetic radiation used to create images of the inside of the body. 45. Zoonosis, a disease that can be transmitted to humans from animals. 46. Hemoglobin, the protein in red blood cells that carries oxygen. 47. Myocardial infarction, also known as a heart attack. It occurs when blood flow to a part of the heart is blocked. 48. Osteoporosis, a condition in which bones become weak and brittle. 49. Gastroenterology, the branch of medicine focused on the digestive system and its disorders. 50. Nephrology, the branch of medicine that deals with the physiology and diseases of the kidneys. Thanks for watching this comprehensive guide on 50 healthcare terminologies. We hope this video has helped you gain a better understanding of the language used in the medical field. Don't forget to like, share, and subscribe to Damal Consult Career Academy for more educational content that supports your journey in healthcare. If you have any questions or topics you'd like us to cover, leave them in the comments below. Keep learning and stay ahead in your career. See you in the next video.